Once the hard work of appraising the available evidence is complete, the nurse's next step is to consider the integration and application of the evidence to the population of concern. This step cannot be performed in isolation. Communication with staff and management are essential to determining whether a change in practice is warranted and to attain buy-in from the stakeholders. No matter how strong the evidence, EBP is impacted by two other major components: clinical expertise and patient values. If these two additional components are not considered when judging whether a change in practice should be implemented, time and effort will be fruitless. Stakeholders must consider clinical questions involving a clinical scenario including client population, nursing staff, ancillary staff, and management. Once it has been determined that the clinical expertise of the staff and the values and preferences of the patients correlate in a positive way, communication with the stakeholders will lead to challenges to a change in practice. Before implementation, consideration of what barriers can be anticipated to the change is crucial. These can include practical barriers such as finances and physical space, as well as social issues such as cultural resistance. When buy-in has been achieved, engaging all the stakeholders in implementing the plan will help to ensure success. It is often useful to roll out the change in practice on a smaller scale to evaluate its ease of implementation and to identify unanticipated barriers to success. Once a smaller rollout has been completed, the nurse is led to the next step, evaluating the outcome of the EBP practice decision.